Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey everybody, welcome back to Between the Sheets. I have a new and exciting guest on with us today. Dr. Ashley Shrader, DNP, just like me, is a family nurse practitioner and IFM certified practitioner with a passion for gut and hormone health, particularly their impact on brain and mental health. After experiencing the impersonal nature of conventional medicine and facing her own health challenges, including an autoimmune diagnosis and a genetic predisposition to ALS, Ashley discovered functional medicine. She pursued certification through the Institute for Functional Medicine and founded Rise Functional Medicine to empower patients, especially athletes and active individuals, navigating hormonal changes. A registered yoga teacher, Ashley integrates mental, emotional, and spiritual health into her holistic approach for healing. Welcome.
Perfect. Thank you. I'm
Yeah.
happy to be here.
Yeah, it is. I'm so excited to have you here. And anybody who's listening and is like, well, what the heck does gut health have to do with sexual medicine? It has a lot to do with it. Okay, you guys?
Yes, there's so much.
Yes. So first tell me, how did you, I know you said you have this predisposition. So kind of how did you get into founding this and having this business? And then we'll get into the gut health.
Yeah. So in my late 20s, I was diagnosed with Hashimoto's, and I was so young, and I was a nurse at the time. And I could not believe that the response was, we have no idea what's driving this, what triggered this, but we do know you're going to take this medication for the rest of your life and go on, have a nice day. And so that was around the time where there was more and more functional medicine being integrated, especially around Hashimoto's in an autoimmune disease, being integrated into the internet. And I just learned so much about functional medicine through that process in my own health journey, because even with taking the medication, I wasn't addressing the underlying factors that were contributing to the entire disease process. So I didn't feel like much better than how I had felt before. So when I did take the time to really investigate those causes, it made a huge difference. And it's been an ongoing journey. This genetic predisposition too, this is more recent, learning about that. Okay. And I watched my mom, she had ALS. I watched her go through it, and just understanding, the whole neurodegenerative disease world, there's just so much unknown. But I strongly believe that, especially gut health, but just functional medicine, gut health, there's so much that can be done to support these patients, for people who have genetic predispositions, to prevent the onset of these horrific diseases. And so I'm really passionate about just the gut and the brain as well.
Yeah, that's awesome. I love that. And so what are just some off the cuff tips for us that, we eat the American diet, not always healthy, not always perfect. How can we get ourselves in a little bit better gut health?
Sure. So there are some basic strategies that I will give patients who are just looking to improve their overall gut health. One is just simple: make sure you're getting 35 grams of fiber a day. There are some easy ways to do that. If you like chia seeds and flax seeds, those are good, just low hanging fruit. Get to 10 grams, real quick and easy for breakfast. So I'm always shooting for that number. In terms of prebiotic rich foods, primarily inulin and polyphenols are going to be your big sources there. So with inulin, that's thinking things like garlic, onion, asparagus. There are actual, if you've ever had those chicory coffee substitutes, chicory root, that's a huge source of inulin. So that's going to be feeding, we'll talk more about this as we go, but that's going to be feeding the good short chain fatty acid producing organisms in the microbiome. And
Okay.
then there are polyphenols, which are feeding the organisms that really keep our gut lining strong and healthy.
Mm.
And so we're going to get those from like green tea. Think about like just anything that's like dark green or
Okay.
purple, red. So getting some like one or two sources of the polyphenols and the inulin a day, I think is huge. And that's where I start is like through the diet.
Yeah.
And then of course, like you can't go wrong with probiotic rich foods if you can tolerate those, the kimchi, the
Sure.
sauerkraut, that kind of thing. If you treat those like supplements, a couple
Hmm.
tablespoons a day, as opposed to like taking just a random probiotic from the
Yeah.
store, is going to go a lot farther. Yeah.
That's so interesting. Yeah, I've heard that about the kimchi and the sauerkraut, and I just don't know that I want to. I love sauerkraut, by the way. I'm a huge bratwurst fan, but I'm not sure that I have just taken a spoonful of sauerkraut before. So that might need to be a new practice for me.
I am doing it hardcore right now. I'm on antibiotics I got a tick bite. And so
Okay.
like kind of prophylactic for Lyme. And
Yeah.
I've been on it, the antibiotics for now a week. So I'm just doing it every
Yeah.
day. Like it's part of it's like medicine right now.
Yeah.
Yeah.
Yeah. That's fantastic. So, do you have people that come in with sexual concerns that you're able to improve through gut health and functional medicine?
That's such a great question. So it's never like a direct, like linear coming
Yeah.
in, of course, but yes, they're so wrapped up in each other. Um, you're probably familiar with that term, estrobolome. That
Hmm.
is like um, so this is really means a lot, especially for perimenopausal and menopausal women.
Okay.
How well our microbiome can excrete estrogen. So
Yeah.
there are certain organisms that can live in the microbiome that will either make it so that we excrete a lot of estrogen or
Okay.
make it so that we reabsorb a lot of estrogen in the body.
Okay.
And so either way, if there's like some overgrowth or undergrowth of those organisms, whether we're losing lots of estrogen from the bowel or
Hmm.
whether we're reabsorbing lots of estrogen in the bowel, there's definitely I've seen improvement just through that, like
Okay.
modulating that component of the microbiome. So that's either treating dysbiosis where there's bacterial overgrowth, or if we've
Okay.
got a lot of undergrowth, it's really restoring those healthy organisms in the microbiome that will help slow down that estrogen loss
Yeah.
through the stool. Yeah.
Oh, that's really interesting. And I'm in perimenopause, so I am all ears.
Me too, girl.
Yes. Yes. All the help,
Yeah,
please.
yeah. It's fascinating. Yeah, so that's like I've seen it in like perimenopause and menopause. That's the strongest leak I've seen in
Okay.
terms of like what's happening with like especially sex drive or vaginal dryness we'll often
Hmm.
see where there's just complete what happens is our body is really relying on these organisms in the microbiome to kind of like balance out estrogen and estrogen
Hmm.
metabolites. And
Yeah.
so if we've like been taking lots of antibiotics, which
Mhm.
many of us have had to, who know, like
Yep.
lots of reasons, of like recurrent UTIs, so
Yep.
common, right, in
Yep.
menopause, there's going to be some just undergrowth. And so if
Yeah.
we don't have those organisms there, what's going to happen is we're not going to reabsorb some of those estrogen metabolites that we need to kind of sustain estrogen levels. We're going to lose a lot of estrogen.
Hmm.
And then we're just going to be more prone to like things like that, the
Yeah.
issues, frequent UTIs, vaginal dryness,
Yep.
and yeah, there's really interesting literature
Hmm.
on a certain phylum of species that lives in the gut called Firmicutes. It's kind of
Okay.
like the phylum that has like lactobacillus. It's a really
Hmm.
common organism. So there's a really strong correlation between our testosterone production
Okay.
and the level of firmicutes in our microbiome.
Hmm.
So if we are low, which a lot of folks are,
Yeah.
low in that particular phyla, we'll end up seeing lower levels of testosterone. And
Hmm.
so if we can get like, so lactobacillus really feeds on like I was saying before, kind of the inulin, especially that
Yeah.
prebiotic. If we can really give the lactobacillus what it likes to eat, and sometimes we use probiotics for that, we'll
Mhm.
actually see changes in testosterone levels too, which
Mhm.
is, really is a big driver in
Yeah,
arousal and yeah, sex drive.
absolutely. Do you see that in men with low testosterone too, or just women? Yeah.
Men, yes,
Okay.
definitely. Yeah, in both. Yeah.
So because I deal with men with low testosterone all the time.
Mhm.
So the guys who are like on the lower end of normal, but not quite, there for replacement therapy, what are some things that I could suggest to them to eat to kind of help balance this out?
That's a great question. So, so kind of thinking it'd be interesting to know if that, because a lot of people just don't have any lactobacillus in their
Mm,
gut whatsoever.
okay.
If they're, a lot of people are just going off on their own now and doing stool tests and learning this about their own microbiome.
Okay.
They're ordering these stool tests on themselves. And so I'm in somebody who's just like I was describing before, has been on
Hmm.
frequent multiple rounds of antibiotics.
Yeah.
It's very likely that they have undergrowth,
Okay.
that type of dysbiosis. Then we want to instill the lactobacilli in the gut. So that's
Okay.
going to be through the probiotic rich foods,
Okay.
kefir, kimchi, sauerkraut.
Yeah.
That's going to get you the lactobacillus there, and then
Okay.
you want to give them the prebiotics to feed on. That's their
Okay.
food, right? So that's going to be through inulin and artichoke, Jerusalem artichoke, garlic. If those, what you could do is like look up a list of some of those foods
Yeah.
and see what you like and just turn it into something that's like a part of your regular uh
Okay.
your regular like grocery store run and just try to
Interesting.
incorporate it in. So I'd say inulin's probably the most powerful prebiotic that we have for that
Okay.
particular phylum, the feeding the lactobacillus. Yeah.
Yeah.
Prebiotics,
Interesting.
probiotics, definitely. Yeah.
That's really cool. I always look for tips and tricks to tell my guys, outside of Western medicine,
Yeah.
the more holistic approach. And so that's really helpful for me. Thank you. I love that.
Yeah. And there's, of course, we're always thinking or when we're talking about like erections, uh,
Hmm.
nitric oxide production, right?
Yes.
And so um, we convert like through our oral microbiome and also through our stomach acid, we are able to convert dietary nitrates into actual like nitric oxide. And so we just
Awesome.
rely on those processes. So we need a healthy oral
Yeah.
microbiome and we need good stomach acid production to be able to make nitric oxide. And if you're not
Okay.
familiar with that, that's what allows our blood vessels, our vasculature to expand to allow for
Hmm.
that blood flow to have an erection.
Right.
So if we are so to if we're thinking about erections and the
Yeah.
microbiome, just simple things, right? Like oral hygiene, just like
Hmm.
flossing every day, going and getting your teeth cleaned every 6 months, avoiding the use of like really stringent, like alcohol-based mouthwashes, where you're just like
Okay.
killing the microbiome in your mouth.
Yeah.
And then in terms of
My
stomach,
guys are going to resist me when I tell them they have to floss every day. If you want better erections, guys, start flossing every day. And they're going to be like, no. Like, that's such a simple thing. That's amazing.
isn't that no, it's incredible. I know. And in terms of like stomach acid production,
Hmm.
that's really dependent upon a few different things. When we are eating,
Hmm.
we are trying to be like in that parasympathetic, right, like
Yeah.
rest state. And so we're all just like so bombarded with information right now, but really trying to not work, not look at your phone, not watch TV, not read a book, not,
Yeah.
like not watch the news while we're eating, so that our body's like, okay, all right, it's time to like make some stomach acid and
Yeah.
get that going. Whereas if we're
Okay.
just like, you know, the other piece of advice I give for this too is every time, like every bite, especially with the higher protein foods, like chewing really slowly, like
Okay.
30 times per bite is a good metric for that.
Okay.
So chewing really slowly again to get that digestive enzyme production, stomach acid production going, so that
Mm.
you're able to make nitric oxide. Yeah.
Okay.
So eating slowly, chewing slowly, and staying focused on the food can really make a huge difference too. Yeah.
That's awesome. Are there any particular foods that would increase the nitric oxide, or it's really getting the acid production?
No, you're right. Yeah. So yeah, so those higher nitrate foods. So that's like your beets, your leafy
Okay.
greens, and so yeah, those are all good. Like they're just so many benefits to those as
Yeah.
well, right? So
Yeah.
yeah, those are the big ones. Yep.
Okay. And
Mhm.
just a small caveat because I see this, beets can change your urine to red, and you may think that you are bleeding. Please remember that you had beets so you can tell me when you come see me in the office and I don't think you're actually bleeding.
Yeah.
I
And
can't tell
like
you how often that happens.
that's true. And yes, because you work in urology,
Yeah.
those are like also high oxalate foods. So you want to make sure that
Yes.
that's okay with your
Yes.
urology.
Yeah,
But
if you're a kidney stone person, you gotta check with us first.
yeah.
Absolutely. Although getting an erection and having kidney stones, I mean, some guys might argue the erections are more important.
Oh my goodness, that's so true. Oh my
Yes.
god.
Yeah, absolutely. That's fantastic. Okay, so we talked about erections. How about like women who are getting recurrent yeast infections? I know we talked about the estrogen for the recurrent UTIs, but that's a lot. And women don't want to have sex if they have a yeast infection. Men don't want to have sex with their partner if they have a yeast infection. How can
Yes.
we kind of help them with that?
Oh, that's such a great question. So, what we know is that we want that so the microbiome, the gut microbiome, the vaginal microbiome, there's a lot of uh, overlap between the
Yeah.
two. Um, Lactobacillus, again, like lactic acid producing
Hmm.
bacteria is what's ideal when we're thinking about the vaginal microbiome. So
Hmm.
going back to how we can support the growth of lactobacillus
Yeah.
is key. So there are I haven't so I've had more success using actual like probiotics like
Mm.
Lactobacillus reuteri for these particular cases where we're having issues with like recurrent
Yeah.
vaginitis. And so sometimes I'll use a probiotic strategically for that. They actually make some as well that are like able to be inserted vaginally.
Okay.
Um, and so you want to talk to your like provider before
Hmm.
doing that, but it is something that I've seen be very therapeutic in certain
Okay.
cases. Um, I do think it also getting an actual like in that case working with a provider that can help guide you through like getting a stool test done and really
Hmm.
understanding what could be contributing to overall like dysbiosis, which is just
Sure.
overgrowth or undergrowth of organisms that we don't do or don't want.
Yeah.
Um, that can be so helpful and so valuable because
Yeah.
what a stool test will do is help you assess like what I was talking about before. Are we making enough stomach acid? Are we digesting our fats okay? Are we
Yeah.
making how's our pancreas doing? All the way down to like what's our large intestine, like what's the colon's microbiome looking like, and
Yeah.
yeah, where what organisms are missing? Where do we really need support to get a more balanced microbiome.
Yeah.
Uh, and then in those stool tests too, it's great because it will tell you if there is like a major like overgrowth, fungal overgrowth,
Okay.
or a and they'll also run like culture and sensitivities on those as well. So
Okay.
you'll be able to say, okay, I can use this like agent for this and probably
Mhm.
have pretty good success. And so, like, I've seen that quite a bit where
Mhm.
there's recurrent vaginitis, and then also in the microbiome, we're seeing like heavy candida overgrowth
Okay.
as well. And
Okay.
so, sometimes we just have to treat that with
Mhm.
an actual antifungal. Yeah,
Yeah. Yeah.
yeah,
That's
program.
interesting. Yeah, and I always look into, are they diabetic? Do they have pre-diabetes, things like that for my ladies who are coming in one yeast infection after another, because you certainly want to get that under control for them as well.
So
So that's
true.
always interesting. Yeah.
Yes, and also just thinking about like
Mhm.
the overlap there between what's going on in the microbiome and metabolic health. So
Mhm.
if we, so it's one compound that the microbiome is responsible for making is short chain fatty acids.
Yeah.
And so those short chain fatty acids will go around and actually like interact with our endocrine system and actually help us to regulate our metabolism. Like they use the
Yeah.
same pathways that those that the GLP-1 medications are using.
Okay.
And so there's direct interaction between our gut and our hormones and our metabolism through
Yeah.
that GLP-1 pathway. And it really does, there's a lot of overlap. So a lot of times what we'll see in these situations where there is insulin resistance or PCOS or
Yeah.
pre-diabetes, type 2 diabetes, is that there is an underproduction of those short chain fatty acids. And we really need to feed the right organisms to
Yeah.
get that short chain fatty acid production up so that we can have better success managing the insulin resistance issue.
Yeah. Interesting.
Mhm.
So if you have somebody who comes in with, complaint of pelvic pain, hurts when they have sex, sometimes they just feel really tight, sometimes it feels like it's throbbing, things like that. I know how I kind of work through that from a urology perspective. Talk
Yes.
to me about how you work through it from a functional health standpoint.
This is a great question. So, um, I think there's a lot. I want to understand where they are, like in
Mhm.
terms of perimenopause,
Yeah.
postmenopause. I mean, many times just getting them some relief with like vaginal estrogen is
Yeah.
like just amazing, isn't it great? Like
I
just
love vaginal estrogen. It is my favorite thing to prescribe. I mean, it helps with everything. Women, if you're not on it and you're in perimenopause or you are postmenopausal, go talk to one of your providers about
yes,
getting some vaginal estrogen because it is life changing. And no, it does not cause cancer.
yeah. Thank you, thank you.
I'm such a huge proponent of it.
Same, same. So like, yeah, like I'm immediately like, if somebody's having vaginal dryness, we're
Mhm.
gonna have that conversation, right? Like, it's not like
Yep.
we need to do labs or anything. I mean,
Right.
it's probably gonna be pretty powerful.
Yeah.
Um, but I will end up like, usually there's a little bit more going on, as well. Like they'll have some
Yeah.
other systemic symptoms that they want to investigate. So a usual, so if somebody comes to me with a symptom like that, indicating there's some hormonal,
Hmm.
imbalance going on, I'll definitely get her started on vaginal estrogen, but
Hmm.
we'll also go a little bit deeper based on the symptoms that she's got.
Yeah.
I'm looking for I'm always looking for like nutrient deficiencies.
Okay.
This can be kind of helpful when we're assessing the health of the gut. Like it can
Sure.
help us kind of pinpoint um, it if there is a nutrient deficiency, like where we're having some digestive insufficiencies. So, like for example, if we have bacterial overgrowth in the small intestine, we'll often see
Hmm.
really high levels of folate because a lot of those bacteria where we shouldn't have them in the small intestine are just
Hmm.
cranking out folate.
Okay.
Uh, so it's like, oh, maybe we need to investigate small intestinal bacterial overgrowth.
Yeah.
We can see something like that if somebody's got bloating or something like
Right.
that. And then when I'm thinking about, like for example, this woman, like her ability to make testosterone endogenously,
Hmm.
I'm thinking about some of the nutrients that are really important, like cofactors and testosterone production. So, um, zinc is pretty critical, especially as it
Hmm.
relates to how well the testosterone receptor works. So, just making
Okay.
sure we have optimal levels of zinc. Vitamin D, important cofactor for testosterone production.
Hmm.
So, just making sure we got adequate vitamin D. B12 is another big one. So, if I see in the hormone labs that there's a nutrient deficiency plus like a
Hmm.
testosterone deficiency, we'll usually work on figuring out what's driving the nutrient insufficiency
Okay.
deficiency that's causing the testosterone
Right.
issue. We really try to work on it through that piece, like what's going on in the gut that's contributing to the deficiency, and then we may replete the nutrient deficiency, see if we can't get that
Mm.
endogenous testosterone production up a bit or get some symptomatic relief.
Yeah.
Then, always testosterone therapy is an option.
Right. Right. Yeah. Well, very interesting. All
Mhm.
right. I'm going to throw one at you here.
Okay.
So we have listeners that love anal sex, right?
Mm.
Men, women, all of it. So, how can we keep our gut healthy enough that we have regular bowel movements so we can have nice, clean anal sex? And is that okay for your gut microbiome?
Wow, that is a great question. Yes. So regular bowel, I do, yes, regular bowel movements are super important.
Yeah.
So especially like if we're really trying to engage in anal intercourse and
Mhm.
it be comfortable
Right.
and enjoyable. So the under a couple of things we're thinking about. One is motility, so
Mhm.
gastrointestinal motility, which is driven by our nervous system. So our nervous
Okay.
system is kind of running the show there. So stress is always going to be a big one. So making sure that every day we're kind of activating that a relaxation, we're eliciting like a
Okay.
relaxation response, even if it's just 5 minutes a day, something that is figure it's different for everybody, but figuring out what is relaxing for you. I like to use like before I use tapping before bed. Like have you
Okay.
ever heard of that? But
Yep.
there's good evidence for it in terms of like lowering
Mhm.
cortisol and improving sleep. But everybody's got their own thing, and so really that is key. Kind of like if we
Okay.
don't have the motility right, then we're not going to have regular bowel movements. So
Yeah.
that's number one, and that's primarily through what's going on with your nervous system.
Okay.
Um, the other piece there is motility shuts down when we are eating. So if
Okay.
we're eating like 10 small meals throughout the day, our motility is going to be shut off. Uh,
Okay.
so that's going to dysregulate our ability to like our ability to basically move debris and food and organisms through the gut. Uh,
Okay.
and so especially if somebody's dealing with any kind of like bloating issue or
Mhm.
any kind of IBS or chronic constipation, I think there's this misconception that like the more often I eat, the more likely it's going to like stimulate motility
Yeah.
and have a bowel movement, but it's actually the opposite. I'm
Okay.
taking a break from eating, like eating 3 meals a day instead of like six
Yeah.
to 10 will allow
Okay.
what's called the migrating motor complex
Yeah.
to turn on so that you can stimulate motility so that you can move everything through and have a bowel
Yeah.
movement. So yeah, those are kind of like the easiest strategies for that.
Okay.
And then, like I was mentioning before, the fiber is key, like
Mhm.
fiber, really important,
Yeah.
right? Like for cleaning out the bowel.
Yep.
So if you're gonna do like a fiber supplement, it can be
Mm.
constipating. So you just want to be careful with that.
Okay.
Hydrate. I mean, the biggest
Mhm.
piece is hydration. So if you do integrate like some psyllium husk fiber, which is I think great,
Yeah.
I would just make sure you're getting plenty of water along with that,
Okay.
and that can really help to regulate bowel movements as well. And then lastly, one thing I'll often check for, especially if somebody's struggling with constipation, is
Mhm.
their magnesium level. Like just
Okay.
make sure. So I look at like a red blood cell magnesium, and I want to make sure it's like 5.5 to 6.5, like
Okay.
in the upper end of the reference range, especially in somebody who has constipation
Okay.
or anxiety, any kind of symptom of magnesium
Yeah.
deficiency. Um,
Interesting.
yeah, so I'd say those are, key, and then,
Yeah.
of course, like, pelvic floor health,
Mhm.
right? I'm sure you
Yes.
preach about this, but,
Yes.
so where I practice,
Mhm.
like, in the DC area, I have found really good pelvic floor
Mhm.
PTs to make sure that I have patients all the time asking about like this, like anal sex and
Yep.
the and they're concerned about like their pelvic health and
Mhm.
what's going on with the muscles down there. And so I think it's like we could all benefit from pelvic floor
Yes.
PT, don't you think?
Yes.
Yes.
I feel like we just all need to do it every day. Like we just all need to watch YouTube and go to the therapist a couple of times so you know what you're learning and doing correctly. And then just everyone has to do pelvic floor. Everyone.
Exactly. Yeah, because everyone, totally. And I'm a healthcare provider, and I was blown away after having
Yeah.
my first kid going into floor PT and just learning like, no, it's not all about like strengthening your pelvic
Right.
floor. There's so many different
Yeah.
variations on what's happening down there, and for many of us these days, it's like learning how to relax it.
Absolutely.
Yeah, and so
Absolutely. which
I
has a huge factor when you want to have anal intercourse. You have to
completely.
learn how to relax those muscles down there.
Completely. And the beauty of what they do is they are trained in like manually like assessing what's happening
Mhm.
inside. And so it was something that we would never be able to figure out ourselves, you know.
Right.
And so having that like objective data, and they can even measure too, like
Mhm.
they have tools and devices where they can measure like pressure
Yep.
and strength, and really help assess objectively like weakness or like progress. And so
Yeah.
I think that's key for anyone, but especially
Yeah.
if like we're engaging in anal sex, we want to make sure we're staying really healthy down there.
Yeah.
Yeah.
Absolutely. Now, I do have some patients and listeners who have talked to me about, using an enema or things like that. I'm not a huge proponent of that because I know it messes with your gut microbiome, but talk to me about how you feel about that.
Yeah. So like I am not a fan, and I just haven't seen like, yeah, I'm not a fan. Yeah,
Okay.
I really know. Like, unless you're
Yeah.
like, it's emergency, you're in the
Yeah.
ED and you can't haven't had a bowel movement in a long time, you're in a lot of pain. Like, I think that's like when it makes sense. But
Yeah.
just to like kind of clean things out is
Yeah.
not ideal. The same with, I'm just not a fan of like colonics.
Mhm.
There's just like so much risks involved in that, and
Yeah.
I don't think we really understand what's happening to the microbiome when
Right.
doing that. And so I mean, and it's also kind of a similar thing as an enema, I guess. So I'm
Yeah.
guessing it's not a great. So I don't recommend that.
Yeah.
But I do have a lot of clients and see a lot of patients that do it just because they like
The
kind of counter.
feel cleaner or something
Yeah.
about it. Yeah, yeah, yeah. Yeah, absolutely. Yeah, I have never been a big proponent of it either, but I was curious from your perspective what you thought as well. So, glad we're on the same page.
We're on the same page. Yes.
That's great.
I mean, it's
Are
like the Wild West out there in like, the wellness world and
Yeah,
social media. I'm sure, there's a lot of like functional medicine people out there just saying
yeah,
that it's good for you. But yeah, totally, not my
yeah, yeah, absolutely. What other things have you seen patients come in from a sexual standpoint that you've been able to help them with?
thing. So I'd say it's interesting. So a lot of patients that come to see me have gut issues. And
Mhm,
so they've been just like struggling with like a lot of times it's like bloating and
mhm,
just either chronic constipation or IBS. And by the time they get to me, they've been to the gastroenterologist and
mhm.
had like a colonoscopy and all the workup.
Yeah,
And so they just are trying to figure things out from a different way. And
mhm.
I think well, I know that just having digestive issues doesn't feel good. Like, you don't feel good
Sex
when
it's
your
not
body
sexy.
sexy. It's not sexy. Like, feeling bloated, like, who wants to have sex when they're bloated?
Right,
It's like,
right.
yeah. And so,
Yeah,
a lot of the folks that I see, like, they wake up in the morning after their first like meal, they're bloated.
yeah,
And then they're bloated the rest of the day, and it's like that's their life every day.
yeah,
It doesn't
yeah.
go away. And so, um, what we're trying to do is get to the root cause of that. And there are lots of things that we can do to investigate that. Like
Yeah.
I was mentioning before, in this with the stool test, when we're having bloating after eating, we're
Mhm.
thinking potentially like a stomach acid insufficiency or a pancreatic insufficiency, which is so treatable. And
Mhm.
um, I mentioned this earlier, small intestinal bacterial overgrowth, which is measured by we diagnose it by a breath test.
Mhm.
They drink this. Have you heard of this? You drink this like
Yes.
lactulose solution and breathe into a bag, and it's basically measuring the hydrogen and methane gas.
Mhm.
So what happens when there is overgrowth of organisms from large into small intestine, and there is that overproduction or that like based off of fermentation
Mhm.
of those organisms, there's just a lot of gas, and so
Okay.
that gas can um, push up against like the esophageal sphincter,
Mm.
cause some like heartburn,
Yeah.
reflux. It can just be really, like I was saying, uncomfortable and unsexy. And
Yeah.
when we can figure out what's driving that bacterial overgrowth process, which is typically like either like a motility issue, like we were
Mhm.
kind of discussing before, or potentially like an upper digestive insufficiency somewhere,
Yeah.
because those like, for example, pancreatic enzymes are antimicrobial. That's one way in which we prevent bacterial overgrowth from occurring in the
Okay.
first place. So if we can kind of get in there and figure out what's driving that process that's causing the bloating, it's so treatable. Like it's
Yeah.
something that is so treatable. And then when we remove, if this is really being a process being driven by bacterial overgrowth, and we remove that overgrowth, then it's all about like what we were talking about regarding feeding the good organisms, and so prebiotics, probiotics, and then in some people we use like the postbiotics like butyrate,
Okay.
short chain fatty acids as well. Yeah.
Okay. Interesting.
Yeah.
Yeah. And I think, we have all had a meal where we just don't feel well or whatever, and none of us want to have sex at that point. Well, at least I don't. I shouldn't
No,
speak for everyone, but I would imagine most people, when things aren't right down there, don't want to have sex.
completely fair.
So yeah, I think this is a really interesting talk. I really like learning about this and being able to incorporate such simple things throughout the day that have such a major impact.
Completely agree. Yeah.
Yeah.
And I'd say one other thing too, I've just that popped into my head thinking about like sexual dysfunction, like, and really a lot of that is driven by blood flow, right?
Yeah.
You probably preach this, but like ED, when somebody presents with ED, we're thinking like, okay, what's going on in your vasculature? Like what's
Yep.
going on in your blood vessels? Like we're missing something here.
Yes.
And the gut, we know, plays a big role in lipid metabolism.
Yep.
There are metabolites from the gut microbiome that regulate what's happening with like with plaque formation, and the risk of atherosclerosis. So that's a red flag, like new onset ED, and I think even in women, just like loss of sexual stimulation. It's not as obvious, but I still think it's definitely related and something that's worth looking into. And there's definitely there's a relationship there. Yeah.
Yeah, I agree. Especially younger guys coming in their 30s and 40s, and all of a sudden they're having erection issues, one of the first things I tell them is they need a cardiovascular workup. Because you shouldn't be having, physiologically, you should not be having erection issues that young. And so there's something going on. And, cardiovascular wise, if we can get you balanced out, and if we can get your gut health balanced out, so you're making that nitric oxide and things like that, then, I think that gives us a better option and a more natural option to help these guys than here's some Cialis or Viagra.
Exactly. Completely agree.
Yeah, actually fix the problem. Because that way then Viagra and Cialis are still there when they need it later on.
Yeah, exactly.
We don't use those too soon. Tune into another episode for ED. Yeah, so I think, this is just such great information. And I was so excited when I came across your profile on LinkedIn, because this is just such a phenomenal topic, and so much of what goes on throughout our entire body is based in our gut. And so I was really excited to have you on for that. And even more so that you're in the DC area, because I'm in Columbia, Maryland. So, that's where my practice is. And so we can refer people.
I love it.
I love it.
Awesome.
Yes. Absolutely. What a great conversation. Thank you so much for coming on. In the show notes, we'll put some links so you guys can be in touch with Ashley and, kind of keep up with what she's doing. And if you have any questions, you can reach out. Thank you so much for listening today, Ashley. Thank you so much for being here.
This is so fun. Thank you, Stephanie.
Yes, absolutely. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday. Because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.